are going to keep going up. We have nowhere come close to hitting that peak of the curve, but if we continue to do what we're recommending, we will hopefully flatten that curve as much as we can. And again, that's to protect our capacity of our healthcare industry to make sure that if and when Virginians come in and they need hospitalization, that we have the beds available, especially ICU beds, that we have the staff available, and that we have the equipment that we need. And so, again, we're looking at science, we're looking at data from other countries, from other states, and we're looking at several months.
Governor, those who run barbershops and salons have talked about having the opportunity to maybe see clients per appointment versus having a shop full of people. What do you say to them? And then on the sidebar, when the president says he's talking to governors all throughout the United States, are you in communication with the White House?
We are, the second part of your question, are we in communication with the White House? And either I or my staff is in communication and takes part in the calls when governors are invited to be on the line. You know, your question is great about barbershops. And, you know, if this lasts for a couple months, several months, obviously we're going to need to continue to get our hair cut. And so we're going to have to work with our barbers, our hair salons, and be creative and find ways that we can do that safely. And it's something that I'm aware of, and we will continue to work on that and how to make that possible.
Governor, can you say more about the overseas shipment? Is that masks? And this was the first time when you referred to other industries that I heard tobacco, so I was wondering, is that masks as well?
Yes, I'm going to let Dr. Carey, if you can address that. Thanks, Doc.
Thank you, Governor. The question was really about what orders we've put out, and that was in addition to try to source things locally and develop new supply chains and production here in Virginia. We are also using the traditional leads to obtain the necessary personal protective equipment that Virginia caregivers, first responders, all the folks who use personal protective equipment need. So there's an order that we have for approximately 1 million surgical masks and 500,000 N95 ordered, and the agreement was a 10-day delivery time. And again, in this environment, you will understand it and appreciate it when it shows up. So we are vetting different suppliers, and when the procurement team gets an adequate signal that this is a reputable source, then we are using our emergency resources to try to get that equipment to Virginians. So that's just an example. And as the governor indicated, the VEST logistics team is vetting all leads. And Brian Ball and the Commerce and Trade Secretariat, among others, as well as those in finance, are following all the business leads that they have. And we're pursuing those. So when there's equipment that we need, that would include face shields, masks, gowns, in addition to face masks. We are acting on that. They're going to be in short supply, and we need to get our supplies in as quickly as possible. And I think we've mentioned in the past we really need national leadership to contribute to the excellent efforts that we're doing here in Virginia.
Just really quick to follow up on what you just said. You mentioned you need national leadership. What specifically would you like to see the federal government do? I've heard some governors talk about the need to, put the Defense Production Act and put that into operation in the fullest extent. So can you just elaborate on what you want to see from the national government?
What I was referring to is that exactly really what you mentioned, that all the providers we talk to around the Commonwealth, and frankly, talking today with folks at a health system in Massachusetts, they too are looking at weeks of supplies in their supply chain. So if we do not replenish that, we will be in a very severe situation. Our number one priority as we care for patients is to keep our caregivers and our first responders safe. So one of the options is to organize at the national level production readily accessible to all states. Otherwise, each state is left, and we're doing it. We're doing it aggressively under the governor's direction to get things as best we can, and that's important, and we're not going to stop doing that. The question, though, is with a country the size of ours and the industrial capability, if that could be directed in an intentional way from the national government. So I think the governor has mentioned earlier that type of direction and coordination at the national level would help every state and every territory. But it doesn't mean we're waiting. It doesn't mean we're not taking advantage of every opportunity.
I have about two more, Kate. Yeah, clarification as well. The order of 1 million surgical masks and 500,000 N95 respirator masks, that is the overseas order. And then also, you know, piggybacking off the Defense Production Act, is there a way that we could do that at the state level and require manufacturers in Virginia to start producing those materials?
I'll have to get back to you on whether that's the order I was aware of that went out yesterday, whether that was foreign sourced or not. We can get information on that for you. In terms of the capability of directing that, Governor, I think our first goal is that we're getting lots of collaboration with our state industries to see how they can help. So right now, I think we're getting excellent cooperation and exploring ways that Virginia businesses can help Virginia and this region.
And two-part here, Governor Northam, we've gotten, I know you mentioned this a few days ago, reports of hospitals canceling elective surgeries. We've gotten tips that some aren't doing that at the moment. If you could address that issue, and as well, I know you talk about flattening the curve and having the capacity as the case number grows. Do we know what that is right now? What is our capacity? Is there a number you can give us?
Sure, I'm going to let Dr. Carey, but the question is as far as our direction to our hospitals to cancel elective surgeries. So if you want to.
Thank you, Governor. A guidance went out nationally last Thursday concerning a classification of urgent and emergent and elective surgery. And we've talked to health systems around the Commonwealth, and by and large, they are adhering to that. Talking to a large health system nearby that they have reduced beyond 90% elective surgeries, and that includes elective cardiac catheterizations and other procedures that consume personal protective equipment and other hospital supplies. So secondly, MSV, for example, put out Tuesday's on Monday, a very strong directive to their membership and physicians around the Commonwealth. This is critically important. Do not do elective procedures until we're able to replenish our PPE supplies. So that's very important. And we're assessing, along with the Virginia Emergency Support Team, has a work group that includes the Virginia Hospital and Healthcare Association, MSV, and other providers, assessing how their members are responding. Most are responding very well, but the governor also has options together with the Commissioner of Health if those measures and those directives from the national level and membership societies, if these aren't adequately addressing the issue, then the governor has other options.
You gotta wrap it up. Thank you.
Thank you all.
And then regarding the our capacity of the health system,
Did you want to address capacity?
So thank you. That's the question of what is the capacity of our system. I think at the Unified Command and the Virginia Emergency Support Team, getting data, and we're in the midst of putting lots of data together from our health systems, understanding all of their supplies and supply needs, not just ventilators, but PPE and capacity issues, and what they're able to surge towards. So that is, we're in the middle of that, of getting that data to be available beyond very aggregate data. So we plan in the days ahead to be able to, we'll be in a position to know exactly what our capacity is and how we're able to flex to meet the needs of Virginia.
Just a final announcement. And The capacity, we want our capacity to be as high as it can, but our hope and our desires is that we don't have to use our capacity, and the way to prevent using it is for Virginians to follow the guidelines that we have outlined and continue to do the things like the social distancing, washing hands, and doing everything that we can to keep the spread of this virus from occurring. So thank you for the question. Thank you all again for being here. We will be here tomorrow at 2 o'clock. We have made a command decision, unless someone feels differently, that after tomorrow we will go to every other day. We will do this on Mondays, Wednesdays, and Fridays at 2 o'clock unless there is some new information that needs to be shared. So thank you all.
Mic check 1 2 for Matt. This is mic check 1 2. Hello. Mic check 1 2 1 2. 1 2 3 4 5 6 7 8 9 10. 1 2 3 4